Hello viewers, this is Niloy Chattaraj welcoming all of you in Transcontinental Times 360-degree live show. As you know, we are bringing the extraordinary peoples from the various fields on every week on our show. Today we have on our show an eminent guest who is a doctor by profession, but a humanitarian by heart. He is a doctor in the Prestige Hospital at Nagpur, that is in India. He has been working in COVID-19 center for the last 6 months non-stop. He has seen most of the people who have been cured, but some of the unfortunate people who die. Today we are going to listen to him on his experience in this pandemic and the real facts in the vaccinations. Doctor, welcome to our show.
Thank you, Mr. Chattaraj.
So,
Uh,
uh,
Hello.
my first question is very straightforward. Since you have worked very non-stop, and I have seen you in very close quarter during that part of the time when the COVID situation was very high in Nagpur. What was your experience? How you handle all this? The situation which required a non-stop working. How you have got the experience of it?
Uh, we had like uh, we had loads of patients coming to us in very critical stages. We have to help them. We have to help them. We had to help everyone. So in we have to diagnose them in what stages they were. We have to uh, give them medicines, give them supportive treatment. If someone required, when assess them, someone required ventilators, we have to give them the ventilator supports, and we tried to protect our staff also from getting infected. And but work was it was we have never seen these number of patients in like I have not seen in 10 years. The workload, the pressure, the uh, we it is like the experiences I cannot tell, but
Yeah,
I cannot give proper words. But it
yeah.
was
It
like
was a huge pressure. Yeah, it was a huge pressure. Right. Yeah, it
and
was a huge
there were
pressure.
expectations from relatives that we have to save their close ones. There were uh, disbelief from the patients and relatives that they had been suffering from COVID and they have landed in such serious conditions. So expectations were very high. The workload was very much, and the situation was tough.
But yeah, it was very tough. Those who were very fortunate, they were cured within 14 days, and those who were died, unfortunately. And we have reported in our Transcontinental Times that doctors were attacked, the hospitals were attacked, the infrastructure, the chair, the glass windows, they were broken. How difficult those times for you, doctor?
Like not very people in India are educated. Uh, so when they take they think that they have brought the patient to the hospital, that means every patient can be saved. If somebody dies, then they think that there must be some mistakes from the doctor's side or from the hospital side. These situations cannot be avoided in such a pandemic where every patient becomes can would have become critical within 4 days of getting infection or get this. So we have handled it. Actually, tried to um, communicate the complications or the situation to the relatives. Some of them agreed, some of them become upset, but that is the general human response to disaster.
Yeah. They forget that the doctors are also human beings. They can try their best to save the lives, but some of the lives are lost, unfortunately. And I have seen, the COVID deaths when I was reporting. two of my relatives died, and that was very unfortunate scenario. But doctor, tell me, what is the basic difference between the normal pneumonia or the influenza and this COVID? Why this is so much means very severe or life threatening? Why?
Like normal pneumonia occurs in um, normal pneumonia and COVID-19 pneumonia are very different. Normal
Yeah.
pneumonia occurs in one or two lobes of the lung,
Okay.
and COVID-19 is a multi-organ disease. It involves both lungs. It will damage your blood vessels. It will damage. It can damage heart. It can damage brain. It can damage intestines. So, and that the course of illness is very short in COVID. Like within 7 to 8 days, a patient uh, who had no symptoms can become very critical, and in normal pneumonia, it takes some more time. Also, there are not much treatment. There is not much treatment available in COVID, and in normal pneumonia, there are a lots of antibiotics, a lots of tests. We can exactly know what bacteria is causing the pneumonia, and we can give uh, uh, particular antibiotic and treat the patient. Mortality is very less in normal pneumonias, whereas uh, here we had like it was difficult. It was difficult to manage. We had
So,
to
so in your
multi-system.
what do you, why do you think that the second wave did rise at Nagpur? Was it inadvertent? That means it will happen whether you are taking precautions or not, or it was due to the you know uh, discrepancies by the people not wearing the mask or not keeping the distance from the each other.
People have means after the first wave, and yeah, after like 2, 3, 4 months, there were still patients coming. Like one of 1 in 10 patients was suffering from COVID, but uh, people became very much relaxed and very much reluctant to uh, take proper preventive measures from COVID.
Yeah, yeah, yeah,
So,
yeah. I
and
have
they
seen that.
like
I've seen it.
there were many gatherings and festivals, outings, and many super
Yeah,
spreader events where many people were like participating in them. And suddenly, the second wave arrived. We had like um,
yeah,
means
yeah.
every means I haven't seen a single person. One in every family member got infected. It was such
Yeah,
uh,
yeah,
drastic condition in Nagpur
yeah, yeah.
in us.
Yes, 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 definitely. And since I am residing in Nagpur, and those periods I have watched it live, it was a very, very, very dangerous situation, and we are living, on the brink of either being. Sometimes we feel that we have been caught with that virus. Sometimes we think we are healthy. So these are the kind of a dilemma which all the people in Nagpur have gone. Now, my main question is that during those tough times, the medications, the injections, for example, remdesivir, they were in high demand. They were being black marketed. And
Yes.
how you made sure that these injections, these medicines are available or were available to your patients without much of the cost?
Since the government had taken the responsibility of distribution of medicines, so
Okay.
as a hospital ourselves
Yeah, please
into
go ahead.
their portal, and we made sure that we got sufficient amount of medicines. Uh, uh, it was difficult also because the patients were like 7,000 to 8,000 patients coming per day, new infected patients per day, and medicines were really running. The city was running short on remdesivir and other medicines. It was all black marketed, but sources were unknown, and we still had to fight with the government to give us what we required to treat our patients, and which was not always sufficient. We had to decide that which patient uh, need it like more than everybody. We cannot give everybody the medicines. So it
Yeah,
was
yeah,
difficult
yeah.
situation.
Yes, yes. So was remdesivir was a life saving injection, or was overhyped?
Actually, it does save lives if it can be, if it is given in early stages of the disease. If we can give a patient we can start remdesivir within 7 days of illness, we can save the patient 100%. So in later
And after,
stages,
yeah, yeah, got, got. Now, whole world is under the privilege of vaccinations, and now everybody is rushing to take the vaccines, and all the governments and all the NGOs are working around the clock to have people getting vaccination. But how does this vaccination works? Please
vaccine.
let our viewers understand in a very simple language.
Yes, vaccination. What vaccination causes is we give component of the infected the virus, some
Yeah,
proteins of the virus. We inject into normal patients. Whose immune system gets exposed to such viral proteins or foreign proteins, and they develop antibodies. Uh, Human body gets some time to develop uh, antibodies to some virus which has not yet infected. So next time when the vaccinated person gets exposed to pathogenic virus, his immune
yes,
response already prevents uh, a severe infection from occurring. Then it can clear the virus with the antibodies uh, which have been produced during vaccination. And
uh, you know uh, mm, some people get infected even after vaccinations, and to my knowledge some people have even died after double dose.
getting dosage,
So
no,
in,
the
in
efficacy,
yes,
the vaccination doesn't prevent 100%. First dose can prevent up to 60% uh, of infection. Whereas efficacy is up to 60%, and after getting second dose up to 90%, patient can not
yes,
get infected even after exposure if he has got two doses of vaccine. But 10% people are still exposed to develop severe COVID infections even after getting both doses. And also immunity also depends. If the patient is suffering from some comorbid conditions, his immunity is low, he can always get um, serious COVID infection. So
so
that's
so
why even after getting
why, I mean, if the person is suffering from say hypertension or the diabetes or any other lungs types diseases, shouldn't he be vaccinated, or should he be vaccinated with proper care and proper checking?
no, one should get vaccinated even if he is suffering from comorbidities until unless some autoimmune diseases. Uh, One should
So
not. Um,
yes, please go ahead.
One should get
Please go ahead.
vaccinated. No, means there is some immunity if you get vaccinated. There is some chance that a person won't get a severe infection. If you are not vaccinated, you are exposed. You can always get a serious COVID infection, suffer from the morbidity, mortalities.
Okay. Okay. So the bottom line is that those people who are suffering from comorbidities should take an extra preventive measure
Yes,
to
yes,
stop this virus to enter in your system. So,
yes.
sir, we have gone through the lot of variants of this COVID virus. First, there was alpha, then comes beta, then comes gamma. Now, the people are talking about the
Delta
delta
and
virus.
Delta plus.
How this
Yes.
delta virus is dangerous? How it is different from the alpha virus, the previous version?
It is more infective actually. Initial
Okay,
strains used to spread from 1% to at least 3%, and this can spread up to 7 people. One patient
okay,
can infect seven people. So that is one thing. The symptoms are actually more of a bad cold. So
okay,
last time, normal COVID infection patients suffered like cough, breathlessness, high fever, and malaise, and these patients, Delta virus patients, can present with uh, symptoms of just cold, bad cold, which is not
okay.
going well,
It's
and they may
it's
land
only in
up
lab.
in
Yes, yes, sir. So
ICU.
it's only in laboratory whether you can detect whether it is delta variant or not, right?
It can be detected. There are RT-PCRs available which can detect different strains also.
Okay.
So it can
So
be detected.
RT-PCR, through RT-PCR, we can detect whether we have a delta variant or not.
Yes.
So does this COVID or this sorry this Covishield and these co-vaccines are effective against these delta variants? What are your
Yes.
opinions?
They are effective against Delta
They
virus
are
also.
effective.
Yes.
And have you detected any case of delta variant in Nagpur till now?
No, we haven't seen
Okay,
any
okay,
Delta variant
okay. So
case.
Nagpur can take a sigh of relief that there is no delta variant, but they should not be extra complacent about that. They should be vigilant. They should wear the mask. They should wash their hands regularly, and always go to the doctor. The first, you shouldn't take medicine yourself. That is what about the doctors are saying.
Yes. Means
Now come to
early.
the third wave. Yes. Come to the third waves. Do you think that in Nagpur the third wave will occur? And if it occurs, what is to your opinion when it should be?
It is too early to say. We were expecting some rise in patients, COVID patients, in August and September, but we haven't seen them. The virus is
Yeah.
maybe one cause, that patient number has been declined and they will not. There won't be any third wave. The reason may be that most of the patients have suffered COVID, and we might have developed some immunity against um, other newer COVID infections. Also, the vaccination drive is going very well. So many patients may have suffered only subclinical infection or may not suffer any infection at all. But
Okay.
still,
What are yes, yes, please go ahead. Please go ahead. Please go ahead.
we still cannot predict if there would be any third wave or no. But if the vaccination drive occurs properly, then there might not be.
Offline. For few minutes we were offline just because of technical snag that happens in Nagpur. That happens in Nagpur. So you can hear me?
Yes, yes, yes. you are audible.
Yeah.
And
So, so, uh,
let,
so, uh, my next question is how means the childrens are now the third target of they are being the few experts are saying that the children are the next target. To your opinion, what is the danger to the children?
uh, I don't think that children will be the next target of the next COVID wave, because I have seen many, means they didn't suffer serious infection in last two waves, but they had COVID infections. I have seen their reports. They had some symptoms, rhinitis, fever, some cough, but they didn't suffer a serious infection. I think that they have developed immunity also against COVID.
That, that's
And,
what we call the herd immunity, right?
yes,
Yes, that's what we call the herd immunity. Okay, okay. So, what do you think how the Nagpurian can prevent the third wave? To your opinion and to your best of your experience, what are your
one,
thoughts on this? What are your advices, in fact?
uh, early taking expert opinions and consultations would prevent, and
Okay.
proper uh, staying in proper quarantine or isolation, uh, wearing masks, avoiding uh, crowded places, and this will prevent. Also, vaccination will prevent third wave.
So, what doctor is saying that in Nagpur, the third waves, which were once seems very imminent, is not so much imminent, and with the help of the Nagpurian people, they can make sure that the third wave shouldn't occur in Nagpur. But Dr. Saab, you must be aware of that fact that in Europe the fourth wave is occurring. Even in America is suffering from the third wave. And last time I have checked it, it was 2 lakh people per day in America. America and
Yes.
Europe, they are rising even after vaccination. Why?
Well, infection will rise. Uh,
Dr. Saab is disconnected from us. That is the problem today we have. We have not so good connections. So मैं हिंदू माफी चाहूंगा, मैं हिंदी जो समझने वाले लोग हैं उनके लिए बता देना चाहता हूं कि
sorry.
डॉक्टर साहब ने यहाँ पर हमें समझाया है कि जो थर्ड वेव है वो नागपुर में शायद न आए, और अगर आपको ये थर्ड वेव को रोकना है तो हमारे जो सिटीजन्स हैं नागपुर के, उनसे डॉक्टर साहब एक एडवाइस दे रहे हैं कि आप अपना प्रॉपर प्रिकॉशन लें, मास्क बांध के निकले, घर में आने के बाद जरूर अपने हाथ सैनिटाइज कर लें, और 2 गज की दूरी जो कि लगभग 6 फुट की जो दूरी होती है वो जरूर मेंटेन रखें, ताकि आने वाले समय में हम ये थर्ड वेव को रोक सके। और नागपुर एक समय टॉप ऑफ द वर्ल्ड में था एज फार एज कोविड पॉजिटिव्स वर कंसर्न, एंड दोज वर वेरी डिफिकल्ट टाइम, and I have watched it, Dr. Saab watched it, and we should avoid all this our bad habits that we have done it for pre second wave. So, Dr. Saab, you have given us a wonder of opportunity to talk to you and your precious time for us. For that, we must be thankful to you. And thanks comes also from your Transcontinental Times 360-degree live show. And I hope that you have enjoyed a lot with us
Yes.
in a conversation. So I hope that soon we will invite you for our further development in the COVID and other situations also. So with
Thank
this,
you.
we come to the end of our segment in Transcontinental Times 360-degree live show. Please do watch this episode, as this will create a lot of awareness uh, inside you. And please do like our TCT channels in Facebook, in Twitters, in Instagrams, and YouTube. With this, I come to the conclusion of this show. Bye bye. Take care.